Yeah, good morning and Barakah de Salah to all our Muslim brothers and sisters out there. It's a wonderful celebration, even though it's low-key, but the fact that we are alive to see the day is so important. I congratulate you on seeing this 2020 Salah celebration. My name is Jumoke Michaels and the program is Summit. You're welcome. Banji, Barakah de Salah.
Yeah, thank you very much, Jumoke. I'd rather say Eid Mubarak.
Eid Mubarak.
Yes, both are acceptable, Jumoke.
Okay.
But the most important thing you said this morning is that we are here and alive to actually celebrate. Our governors, our president, all our leaders have actually been telling us that we pay more attention to our lives. That when we are alive, we'll live to celebrate several Eid in life. Yesterday was Eid, and before then, the Sultan and the PTF actually made a call, a directive, so to speak, that people should observe their Eid at home. And that was exactly what I did. That's exactly what most people did. But some people actually violated this.
Yeah, so many states actually violated that order.
But then, I mean, part of the faith is to actually respect and obey the constituted authority. Even in Saudi, the Eid was celebrated at home. So why would anybody try to think he's closer to God, or he wants to maybe be closer to God by going to Eid ground? Exactly. It was uncalled for.
Even after the Sultan implored all the people to stay at home and just
but thank God we are here, Jumoke, and alive. Yeah. And we are here to actually join our brothers, even as they celebrate at home. These holidays today and tomorrow. So our Muslim brothers and sisters all over the world, we say Eid Mubarak to you. This is Summit, and Jumoke?
Yeah, today on the program we're actually focusing on Ogun State. A lot has happened in Ogun State in the last 1 year administration of the new governor, Prince Dr. Dapo Abiodun, and we're going to be looking at his scorecard in that state, transiting through all the sectors of the state and how the state even fared during this COVID-19 pandemic. You know, how did the governor actually handle the state? Because they also experienced an increase in COVID-19.
Yeah, last week there was a spike.
1 week, yes, there was a spike in that state. So we're going to be looking at how the state has actually fared in handling these issues and what the plans are on ground right now as a way forward to also curtailing the spread of the COVID-19 in that state. And we have with us this morning someone who is very apt to give us information on what is going on in that state. So we'd like you to stay tuned and don't change your dial, just stay with us as we focus and update you on happenings in Ogun State. We'll be back after this break. All right, welcome back. The program is Summit, and today, like I said, we have Ogun State in focus, and that's what we are looking at today. And we have joining us the Special Advisor, Media and Communications to the Governor of Ogun State, Honorable Remi Hassan, joining us on the program. You're welcome, sir.
Thank you very much,
Good to have you again today.
Always a pleasure to be here.
You're welcome.
And good morning, Mr. Busari.
Good morning. Good morning.
I want to believe that all you guys are doing just fine.
Very well.
Happy Eid.
Happy. Thank you very much. But let me just take fire the first salvo. How was it actually celebrated in Ogun State? Eid yesterday. Did people go to Eid grounds? Was there congregational, or how?
Absolutely.
What was the level of monitoring?
No, there was no congregational gathering of any sort. The compliance to the stay-at-home order was total, and Ogun State is, in fact, complied with it in totality. And that's because the various leadership of the faith-based associations helped to drive the information to the grassroots. So people celebrated within the confines of their various homes, and it went well.
Very well. Okay, Jumake, please allow me to take on our guest on the last address by the Governor of the State, Prince Dr. Dapo Abiodun, on Friday, that's the 22nd of May, where he actually addressed the residents of the state on giving a kind of update on the state of things as far as COVID-19 is concerned. As at Friday, he actually reported that the number of cases in Ogun State had risen to 183. But in that, I mean, last week he said there were so many other maybe sort of unusual events. That was the week that the state recorded the highest number of cases, 25 in a day.
Yeah,
one single day, that's 19th of May. Then the state also discharged about 36 patients that day, bringing the number of discharged patients to 87 or 97 rather. How would you assess, since the outbreak of COVID-19, how would you assess the handling of the COVID-19 cases in Ogun State by Prince Dr. Dapo Abiodun, or the state as well, the executive as a whole?
Thank you very much. As of today, globally speaking, the country with the highest prevalence of COVID-19 is the United States. And in the US, you still have where the epicenter is, and that's New York. And if you look at the figures for New York and look at the next state that has the highest number after New York, it's New Jersey, and they're just next door neighbors. Now, our location, our proximity to Lagos, our contiguity to Lagos is something that has exposed us and made us quite vulnerable. So the cases we're recording now is just a matter of when, not if, because it is impossible to come out of Lagos to any part of Nigeria without passing through Ogun State. And there are quite a number of people who eke out a living in Lagos but reside in Ogun State. And they do that on a daily basis, the lockdown notwithstanding. Now, that essentially is the reason why you are seeing this gradual climb. But it tells you also that we're doing some things right. Because before now, if we needed to do a test, we had to come to Lagos. Because the molecular lab in Lagos was the only lab available to almost the entire Southwest, apart from the one that was privately owned in Ede. But about a month ago, Ogun State has been able to acquire its own lab. So the turnaround time for tests has been scaled up. We can now localize tests. We don't have to send samples to Lagos. We now do it at local level. Besides, an international organization named Gene 54 also provided a mobile lab to also carry out tests, which means that our testing capacity as a state has increased. And the number of tests you carry out determines how many more cases you are able to discover. So the increase in cases is not just because the cases are just coming. No, it is because we have been able to scale up the testing capacity of Ogun State. The mobile lab in Abeokuta, the other lab is in the Olabisi Onabanjo University Teaching Hospital in Shagamu. Put the two together, those two laboratories can conveniently do up to 1,000 tests per day. And like I said, our proximity to Lagos, when you test people, especially in the border areas, especially those places that are very close to Lagos, you are likely to still keep finding cases. But the silver lining for all the cases so far is that the recovery rate too has also been very, very high, and the fatality rate has been on a very low scale. That means that we're getting some things right.
All right, the governor also mentioned about some people that keep tripping into the state in spite of the interstate lockdown. Some people that were intercepted coming in from
from the north.
From the north, and then those even coming in from the coming in through the international border, and that was a kind of worry.
Thank you very much. You see, wherever there are opportunities, the human movement will gravitate towards that. When some of our people were gravitating towards Europe and the United States, it's because they believe the grass is greener over there. It's been there all this while that people come towards the southwest, especially Lagos, because they believe the opportunities abound. But it became exposed because of this lockdown. We're now paying more attention to the rate at which people are coming in, which means that we should use the advantage of this discovery to begin now to check how these movements are regulated so that it does not bring any sort of security concern. Put that aside. For those that are from the international scene, most of them are people who either engage in trafficking, whether it's commodities or whatever other things that they traffic in, and looking for a means to get their business going on, especially for those that are smugglers. You will now discover that the lockdown is beginning to make us realize that these people are coming in. And most of them are from places that have a high prevalence of COVID-19. And when you discover that infiltrators come into your territory, the first thing you want to do is be sure that they are safe to mingle with people. And when they are isolated and tested, whether they are positive or not, they will definitely be sent back to that country where they have come from. So I think the vigilance rate has increased, and that's why you see that quite a number of infiltrators, whether the internal travelers within Nigeria or those from across the international boundaries, the vigilance rate is increased, and quite a lot of people have been arrested now, so that they will not unnecessarily give security and health concern.
Yeah, you spoke about the capacity of the testing capacity of the state as we speak. It probably got to about 1,000. Many CDC officials were in the state last week, and maybe to certify the molecular lab in Shagamu. What was the outcome?
Positive, and they gave us a clean bill of health. Go ahead, order.
Now, the state is also actually thinking of the governor called it the see and treat method, so to speak. What does that mean?
Okay. Now, when someone goes down with symptoms, the ideal thing is you collect the person's samples and the person goes back home. Now, it is only when the sample brings a positive result that you go back to look for that person. But the truth about COVID-19 is that as at this time, there is no cure. But every single symptoms that COVID-19 comes with can be treated. Therefore, we are saying, rather than release that person and it turns out positive without you knowing, it keeps infecting others. You just isolate the person, start treating those symptoms, even while the result of the test is still being awaited. When the person's result comes, if it is negative, you may well have been done with the testing, the treating of the symptoms, and the person goes home. If it is positive, he waits further so that the treatment continues. After all, what is going on in the isolation centers are symptoms-based therapies that they are administering on those that are there. So why don't we just commence the treatment of those symptoms even while we await the result of the test? That essentially is what see and treat means. So that we will reduce the incidence of community spread. Because if you allow that person go back home, he infect others. If he unknowingly begin to mingle, not knowing that he has the virus, that essentially is what that thing means.
Okay, I think this should be the last question on COVID-19 so that we can go to...
No, COVID-19, please, very important.
Okay. All right, now we know that many Nigerians have been agitating for homegrown cure for the treatment of COVID-19, and the federal government has said, NAFDAC has already started looking into what they can do about that. And Ogun State is one of the southwestern states where we have so many of those people who practice herbal medicine. What is Ogun State's government doing about that? Are they taking any special interest in that regard?
One of the things we have done is to sensitize those who are knowledgeable in herbal medicine to reach out to the State Ministry of Health, and whatever formula that they have, which they believe can address solutions to this COVID-19, should be handed over and possibly passed on to NAFDAC for the necessary laboratory test so that they can certify that it is fit for human consumption and it truly can address the issue of the fight against the virus. That door is open, and we believe that those who are sure of whatever thing that they have will come forward, but the door is open.
I'm a bit curious when the first address of the president, March 29, the lockdown was supposed to cover Lagos, Ogun, and FCT Abuja. But we found out that the template in Ogun State was slightly different from out of Lagos, even though the order was affected. What actually informed the reason why Ogun State was always coming maybe a week later than maybe Lagos State? For instance, the lockdown did not start on March 31 in Ogun State, started a week later. I'd like to know why. Then the second question is that the easing of the lockdown has actually commenced. The first phase is still ongoing in Ogun State, which is likely to lapse May 31.
Yep.
The second phase will start June 1. Now, tell us all about this and how it has actually been applied, and the effectiveness and the level of compliance.
Thank you very much. Now, when the president came with the instruction of a lockdown for Lagos, Ogun, and Abuja, those are the major entry points, because COVID-19 is an imported disease. It's not homegrown. And like I said, Ogun is geographically married to Lagos. You possibly can't come out of Lagos going to any part of Nigeria without passing through Ogun State. That must have informed why Ogun 2 was locked down along the line. But the instruction took us unawares. Essentially, why the president issued that is because of advice from health professionals that if you do not reduce human movement, you will aid community spread. And that was the reason why the lockdown came. It makes a lot of sense. However, for us in Ogun State, we needed to marry the need for a safer environment in terms of the health of our people with also the economic imperatives of their survival. Because a good number of our people are those who live subsistently. They eke out a living on a daily basis. If we had gone with the instruction as it was handed down, when it was handed down, we would have thrown quite a lot of people into hunger. The state needed to do some bit of stocking up of his food bank to be able to provide palliative to those who may be in need. Because if you're saying people shouldn't go out, you must have another means for them to at least be able to feed. That one is there. Even those who have their money to be able to survive need to also shop. So we thought it wise as a government that we should probably have a tete-a-tete with the presidency, which Mr. Governor did, and a moratorium of 5 days was granted for us to be able to put our house in order and effectively have a lockdown that can truly solve the problem of community spread. And that was why you had that window. The state needed time to stock up its food bank. Those who have their own money needed to shop and put food in their houses. And of course, some of the people too who may have reasons to be geographically located in places that will not help them to survive that period of lockdown and need time to also relocate, use that window to relocate to the place where the lockdown can be a little bit more relaxed for them. So all of these were the reasons why we had it. But then, even as we didn't start at the time that we were meant to start, the number of days that the presidency has put those 3 states under lockdown, we have observed with all sincerity and diligence. And that's why you see us coming few days late after Lagos. Essentially, that's just the reason.
We'll talk about the easing of the lockdown.
Yeah, the lockdown is, for us, you will see that this is our last week of the eased lockdown. For us, the formula is simple. Every other day, there will be a window of activities, 7 in the morning till 5 in the evening. Then you have the 3 hours.
Today is one of such days.
Today is one of such days. Wednesday is another, and Friday is another. Tuesday, Thursday, Saturday, and Sunday is total. You should just stay indoor. Now, this has nothing to do with the federally imposed curfew, because the difference between the curfew and lockdown is that while lockdown has some bit of exemptions here and there, curfew simply says stay behind closed doors. And it is a federally imposed curfew. Federal agents, in other words, law enforcement agents, are the ones who will do the enforcement. And we've always sensitized our people. If you have no reason to be out there because of any assignment that must really have a valid reason to be out there, stay indoor. Because if you are caught, you will do vigil with those people till morning.
Yeah.
All right.
Well
Okay,
said.
so aside issues of COVID-19, this week makes it 1 year in office for the Prince Dapo Abiodun administration. And he's been running that state with the agenda of building the future together. Now, how has this agenda fared in the last 1 year?
Thank you very much.
Let's 5 days, Jumoke. Let's do.
Building our future together is an initiative of the governor that seeks to bring stakeholders into developmental stride. In other words, you don't assume that this is what the people need. You let them be part of what conceptualizes the project, the policies that you end up implementing. The togetherness is the difference. Someone may come and say, oh, I think there should be a flyover here. And the people don't need flyover, they need water. Because water is life. If you go ahead and do the flyover, it may cost you more money. They're not likely to appreciate it. So we are into the people and we make them be part of our developmental agenda. However, that slogan, that mantra, gives birth to 5 developmental pillars. And those pillars are the anchor upon which all of what we've done in the last 1 year has been resting. You have the state anthem called Isheya, and that is where those developmental agenda comes from. I in Ishaya is for infrastructure. S is for social welfare and social well-being. That's where you have security and health put together. E is for education, and that is primary, secondary, tertiary, technical, vocational, and what have you. Move to Y, you have youth development, youth empowerment, culture, and tourism put under that pillar. And of course, the A is our agricultural agenda, which is an evolution and a revolution. What we're doing in Ogun State today, we are prepared to feed this nation in the nearest and foreseeable future. Especially what we put on ground this planting season is such that Nigeria can be guaranteed that at least for us in Ogun State, we are part of the plan for the food security that this nation needs. So it's been so far so good. We may now begin to go into specifics and say this project and that project are either ongoing or have been completed. We can list them, they are numerous. But when any question comes into the direction of that specific, I will address it.
Okay, let me, before we actually go into specifics, let's look at the issue of budget 2020. Globally and even at the national level, there have been reasons for review of budget 2020 based on the economic realities now. In Ogun State, how has this either COVID-19 or the economic, let me say, disaster happening all over, affected your budget for 2020?
There is no one that is immune to the present economic realities globally, not even the economies that purport to be the strongest. Everyone is on the firing line, as it were, because oil is a major determinant of the global economy. And for Nigeria, it's not just the major determinant, it's the only determinant. So when the downward trend of the crude prices began, we as a state already saw trouble coming. And thank God for the team that the state has, especially in terms of the management of the state economy. They are quite up to date and very much on point. We had looked at all of the indicators, and steps were taken to immediately re-engineer the Ogun State economy. As it were today, we are sure that nothing will affect, as much as the structure that has been put on ground, nothing will affect the recurrent expenditure that has to do with salaries of workers, majorly. Now, take that even to project. Some of the steps that we have taken to get back some of our commitment to lenders. Now, inherited by this administration, retinue of exposures, liabilities to this bank, liability to that bank, liability to this bank, everything this administration has put together in one basket and make our pay plan such that is further renegotiated using the new economic regime that the reality of COVID-19 has brought, and we are able to save a lot of money from the repayment we used to have. Now, the difference, the surplus that we are able to aggregate from there, a good chunk of it will help fund some of our capital projects that are ongoing. That notwithstanding, we were lucky, sometimes in March, the World Bank approved for the state a facility of about $250 million. That too will help to do some bit of support for our capital development projects in the 2020 budget and beyond. So we have a lot of mitigating measures that have repositioned the budget such that even if we will not have 100% implementation, what we'll have will be substantial as not to affect the policies and projects and programs of this administration.
But how high or how far is the administration expecting the IGR of the state to increase with this
We may not get an increase this year because we are the industrial hub of the nation. The highest number of industries in any state reside in Ogun State. However, a good number of those industries in this period of COVID couldn't really operate. And if they don't operate, they will not have product. If they don't have product, they won't have income. And if they don't have income, of course, you will not go there and begin to ask them to pay tax. So there will be some bit of, slow down. Yes, that's the word. In the way we have projections about our internally generated revenue. But our experts in the Ogun State Internal Revenue Service are already putting on their thinking cap to see how some of these companies may be helped to bounce back, because it is in our interest that they get back to business. When they get back to business, we get back into full benefit of all of the operations in our state. So we will have some few months of slowdown, but there is hope that there will be a bounce back.
Of course, Lagos State has said that it was going to sacrifice its IGR in order to save jobs. Because when companies are actually compelled to pay taxes and all that, some of them may actually will not have any other option than to actually lay off staff. Are you also thinking of saving jobs in the states?
We will definitely be interested in what will keep every company going. Now, it goes beyond us as a state. What we can do, we will do definitely. But we know that the Central Bank of Nigeria is thinking along that line. And anything we have to do as a state to help those who reside or have their operations within our state will help them interface with the CBN. There is little we can do other than maybe give some bit of tax holiday to some of these companies within this period of low productivity. But then, like I said, what lies ahead is greater than what we're seeing now. This is just a slowdown. It's not a knockdown.
Then COVID-19 actually taught so many people so many lessons. One of the lessons it actually taught was that not so many countries were actually prepared in terms of health infrastructures and facilities. For Ogun State, are you actually learning anything from what COVID-19 actually brought to us in terms of
charting the way forward?
Yeah, charting the way forward, actually updating and reinvigorating the health sector.
Thank you very much. There was already a plan to reposition the health sector of Ogun State, and COVID-19 has helped to further hasten the manifestation of that plan into reality. What do I mean by that? I've said it here before in one of your numerous programs that I was privileged to be present at, that healthcare delivery is in 3 levels: the primary healthcare system, the secondary healthcare system, and the tertiary. Now, at the primary healthcare system, what you do there is to attend to basic ailments: headache, typhoid, malaria, what have you. Even at that level, they can still do some bit of antenatal matters. In other words, people that are expectant, mothers. We discovered that at the coming in of Omobada Abiodun's administration, the primary healthcare system in Ogun State was in comatose. And that means that there will be pressure on the secondary health facilities. Because if there is no health center that could attend to somebody's headache at the village level, he goes to the general hospital where he had no business ordinarily. And at the end of the day, you have hundreds of people waiting to see one doctor. By the time he's done with like 50, his time is up, he closes. And they tell you that, okay, those who are still waiting, you have to come back tomorrow. Do you know how many more will join those people that you're not able to attend to? So we decided 512 number of our primary health centers are being outrightly rehabilitated and equipped, then we also staff them sufficiently. The first number are struggling to meet up with the May 29 1 year in office so that they could be commissioned. Now, we're not thinking of doing it all by ourselves. Some of the plans we have is there are quite a lot of corporate organizations operating in Ogun State. All we'll say is, okay, in your locality, adopt one healthcare center on our behalf, and it will be acknowledged that you did it. Faith-based organizations in Ogun State, they have the highest. Ogun State is like the spiritual headquarters of the whole of Africa.
Thank God you brought this up. You must get that skip our memories. You must get sorry.
I know so. Now, if each of these faith-based organizations are able to adopt one, look at the hundreds of hospitals that will have been put in shape by them, because they don't pay tax. So that is a way to show corporate social responsibility. Now, discussions are ongoing. There are even those that may adopt more than one because they have the capacity to do that. We are looking at all these options so that by the end of this administration's first tenure, we will have touched every single primary health care center. That way, you will be able to nip certain diseases in the bud, and the pressure on the secondary health facilities will be less. They will now be able to attend to cases that are truly special. Because if a specialist hospital is attending to minor cases, what is special about that one? Then the tertiary healthcare institution, the one owned by the state, Olabisi Onabanjo University Teaching Hospital, is already witnessing a lot of turnaround now. Now, some of the things that we quickly had to do because of COVID-19 may probably still have come, but a little bit more delayed. The molecular lab that OUTH has now probably wouldn't have come. When we made inquiries at the time that there was Lassa fever outbreak, the suppliers were telling us that they required 24 months before it could be delivered. But COVID-19 made the urgency much more accelerated, and now it's here with us in Nigeria. So some of the plans were there. COVID-19 has helped to speed them up. And some of the facilities we are using as isolation centers, we're already thinking of metamorphosing them to full-fledged hospital, because they are just doing much more than an isolation center, but a treatment center. So COVID-19 has actually helped to bring to the fore some of the plans we have, and also help us conceptualize the one we never thought of.
All right, another sector we'd like to look at is the education sector, because whether we like it or not, COVID-19 has also seriously impacted that sector, because all students are still at home, pupils and students are still at home. So how is Ogun State working to ensure that children are still preoccupied and getting some education in some form?
We're probably the only, or the first state. Immediately the lockdown and stay-at-home order was given for all schools. We're about the first state in Nigeria to introduce the DG class. And on the state-owned TV station and even the radio station, there are 3 hours of the day that students, pupils can get to learn, especially the basic subjects, English, mathematics, and some of the basic sciences. This is about their 7th week of that program. And we're not planning to stop it until schools reopen. Because for my own children at home, I was shocked when, after prayers in the morning, I went into the room and one of them came and said, "Daddy, come and put on the TV." I said, "What's the problem?" He said, "Our lesson will soon start." Which means, without me knowing, because that particular day I stayed a little bit late before going to work. Ordinarily in the morning I would have left as early as possible. But they've been preoccupying themselves with those classes. But that day they said I should come and put on the TV. The question I asked is, who has been putting it on for you before? They said, it's just that I'm around now. They don't want to do it when I'm around, because I always say, don't touch this, don't touch that. And I went to put it on just at the nick of time, the program started. They had their pencil, biro, and exercise book, taking notes. So we have engaged these pupils, and the buy-in by some of the stakeholders has been very, very encouraging. We have villages that they put TV in the community center and put on generator, connect for these pupils to learn, observing the required social distancing and what have you. So nobody complains that it's because there's no light. That's why I don't participate. So we're engaging them. And at the same time, like the federal government said, as soon as they're able to come up with the template of how schools should safely reopen, we will also be part of that process.
All right, so what about other achievements in the
No, Jumoke, before actually move in the educational sector.
Yeah.
I was actually, before you actually leaves the issue of the school, what about, we are in a digital age. I'm aware that just last week, Ekiti State actually celebrated the internet launch. What's the capacity? Was the state actually looking at digital enhancement so that a lot of students who may not have access to TVs and all that, but who probably on their palm top, on their laptops, can actually get kind of school online, facility. Is the state thinking about that?
We're taking it one step after the other. When two things are important, your sense of judgment will determine which one is more urgent. Now, as important as what you have said is, I think the ICT hub that the state established is already having a plan for that. However, what is more urgent for us is the infrastructure in our public schools. It has broken down. It has reached a derelict and obsolescent state, and this administration, as at the last count, has renovated about 94 of them, and we're still going all the way to them in their hundreds. So one step after the other, because if you're wearing a very nice wristwatch and you're also wearing a rack, nobody sees the wristwatch, they see the rack. But if you're not even wearing a wristwatch and you're wearing a nice dress, just as you're well dressed now,
thank you for
someone sees you and says, wow, I love the way you look. So
Okay.
one thing must come after the other. As important as that is not going to be more urgent than those infrastructures in the various schools, because the learning environment must be right. If you have the best of internet in a dilapidated building, what is the pride in that? It makes no sense. So we are taking it one step after the other. We will get to that point, and definitely it won't be without the necessary frenzy.
You said the government has renovated 94
of those primary
of those
schools.
Do you
Yes.
still have so many of them?
So many. We probably have one of the highest presence of elementary and secondary education institutions in the Southwest.
All right, so why don't have you thought of involving this same faith-based organization to get things done faster like you're doing for the health?
If we are facing the educational sector and calling them into the health sector, let's allow them, succeed on that front first before we begin to overburden them with another thing. The state government can still cope, because under the state universal basic education arrangement, there are some of these renovations and rehabilitation that will still be captured. What the state has done is, from the state purse, the UBEC policy arrangement will still capture some. So if we have options of bringing more buildings into the basket, let's explore and allow the faith-based organization to concentrate on this one that we have for them. Don't be surprised. Some of them may still have their members being beneficiaries of the services that will be delivered at those various health centers.
All right, you said something briefly about water now in the midst of your discussion, talking about maybe the people prefer having water than giving them an overhead bridge. And we all know that water had always been a scarce commodity in Ogun State. But I think someone told me that now they have water more.
Now,
So what are things that have been
the
done
administration
to rectify that challenge?
before the last administration, that's the administration of Otumba Gbenga Daniel, had the opportunity of a World Bank assisted water project. Now, that administration did not succeed to finish the entire thing, but at least some bit of physical infrastructure were put on ground. However, when the last administration came in, the priorities were more on roads. Now, those roads, as good as they are, did not factor in the fact that some of the water facilities are also part of the entire road network, and they were all completely messed up. Now, even when those water corporation points were ready to pump water, we discovered that a lot of pipes were already completely broken because of construction activities. Now, it requires us now relaying some of those pipes and blocking some completely, because when they put on the this thing after we provided the remaining facilities at Arakanga, where you have the major source, you will see that water was coming out even from the center of the road, and that will damage the road if we don't stop such pumping. And that essentially is where we are. But there is a water plan in this administration, and it is such that touches almost every existing water facility in the state, and new ones are also being proposed. But the present water plan, I want to believe that by the time this administration is winding up its first tenure, we will have touched almost every community. Because some communities that we even thought their water corporation will never work, suddenly they told us that water is now running. Some is just power that they needed. Some is just new pipes. And there are those that their own require an entire overhaul. But there is a water plan, and it is working.
Maybe one or two calls, or one or two messages, one or two from our viewers, in order not to shut them out completely.
All right, so you can send us an SMS to the number we display on the screen, 080-233-47-006, 080-233-47-006. Thanks, the number is there. We can take one or two comments or questions you have for Honorable Remy Hassan before we leave the program this morning. Please, not a call. Send an SMS. Thank you.
Thank you. The last time you were on this program, we actually spoke about major construction works going on in some senatorial districts in the state. The Lusada area, that's the one leading to Agbara. It was one of the major roads you mentioned, and some others. How far has the state government gone?
We have finished some, and some are still ongoing. The flagship of road construction efforts, the Jebu-Ode-Ekpe Road, has reached the stage of asphalting and is a 10-lane dual carriageway that links Jebu-Ode with Ekpe, and our target is to decongest the Lagos-Ibadan Expressway so that those going to the eastern part of Nigeria don't need to come through the express. And that way there will be some bit of sanity on that express. The chaos that is there now is such that is unbearable. As early as I left this morning, I still spent 1 hour 40 minutes in the traffic there. But if the number of vehicular load that road carries is reduced through alternative routes, then we'll have less chaos there. So we have the Jebu-Ode-Ekpe Road that is already reaching the stage of asphalting. You have the Abeokuta-Shagamu Road is another one that
how many lanes is that?
Is going to retain the two lanes that it is, but there will be a shoulder so that if you need to park, you won't park on the road. That way, movement along the route will still be there. But we're reintroducing also there will not be grass as median again. It's going to be completely concretized now, and it will be with street light all the way from the Shagamu interchange to Abeokuta. And they have reached a level where even the median that is being constructed has reached about 40%. And the asphalting of one of the sites is about to begin. That's a very ambitious project. We are awaiting the federal government nod on the approval for us to take over the Ikorodu-Shagamu road. Just once too will also help to decongest the Lagos-Ibadan expressway. Same goes for the Papalanto-Shagamu-Ilaru road. We are also waiting. And of course, the one for Abeokuta-Songo-Lagos road. We're also waiting. But we have completed some.
I don't know if you deliberately left out the Agbara Lusada. Was it not part of it?
It's not yet given to us completely by the federal government. But what we have done so far is to do palliative so that it can be passable for people. However, there are some other roads that are linking that major road, like the one from Songo to AIT, which we have completed with sidewalk and street light, is there.
That's true. I've seen
People
that.
now pass through that road so smoothly, even at night. Is a beauty to behold. We have the one in Ijebu, the Ayugbami Street, Ashafa Road, all completed. Even in Abeokuta, some internal roads, the Elite Road is nearing completion. There's another one in the Obanto-Bonogu axis is nearing completion as well. Quite a lot of roads are going on.
Area, I think we had a lot of complaint the other time we were here too.
The challenge with that road is one of those that are captured by the project review committee as needing some bit of further explanations, because we want to know how much has the contractor received and what's the progress he has achieved in terms of mileage. Is what is on ground commensurate with what has been received? You can't keep pumping money into a project that you don't know the extent to which they have gone, and there is no handing over on some of those projects. We will not abandon any project.
Yeah.
That is a policy of this administration.
Special advisor, we're actually winding up because of time, but I won't actually allow you to go without asking you this. I'm curious about what's happening in the educational sector in Ogun State. There's this controversy surrounding the nomination of the Commissioner of Education, particularly arising from the fact that maybe she was dismissed by her former employer. Was that true? Well, people are actually asking why the governor did not do due diligence before.
Thank you very much. Due diligence was done. Now, when you carry out a background check, you can't possibly find everything. Now, at the stages and levels of those background checks, there are those who will further do their own due diligence. When at the level of the governor it was done and passed on to the House also, in their opinion, find it something that can easily pass, and it passed. What happened in the case of Professor Mrs. C.D. Osho is a case of internal matter of Olabisi Onabanjo University, where she had some issues that has to do with her occupation of a particular post, and decisions were taken. Those decisions, she considers them unfair. Now, when it was now brought to our knowledge, the governor did the right thing by stepping down her swearing in after she has been cleared. But forget not that as at that time, she was already, and she is still, a special advisor. She hasn't been sworn in as a commissioner, but she's still a special advisor. When the internal mechanism of finding out more about what the issues with OOU are, whatever decision that befits the situation will be taken with an informed position.
Thank you very much.
Thank you so much, sir. We really need to go now. Thanks so much for being a part of the program. We've been discussing this morning with Honorable Remi Azan, the Special Advisor Media and Communication to the Governor of Ogun State. We'll see you again on Wednesday for another edition of the program. I'm Jumoke Michaels.
Well, let me wish you happy celebrations in advance. That's on May 29. I mean, it will be June 12th. We don't
year.
know which 1 year anniversary of the administration of Prince Dr. Dapo. My name is Banji Busari. See you on Wednesday.
That time I not getting phone number.
Your own brother, you not getting phone number.
I not get.
How long has this friendship been on for?
15 years.
15 years.
Do you think that is fair?
I know that it's not fair, ma.
You know, but you still want to be unfair.
After all, we had sex together.
Judgment for the claimant in the sum of 85,000 naira.
We are friends now. Anything can happen. Me, I don't know.
I will pay you this money in 2 years' time.
2 years.
He's selling lies.
You collected your what?
So you asked him for 85,000 naira because you
enjoy
wanted
Christmas.
to party in December?
Why is your agency fee 50,000 for a 60,000 naira rent? I thought it was 10%.
He said,
I don't really have money, but I will see what I can do.
So you were intentionally deceptive.
You can't pay me back. So you don't expect me to give you the watch and the phone.
Case dismissed.
Judging Matters, showing every Monday at 6 p.m. WAT, only on Africa Magic Showcase.